That's okay.
Okay. You need to stop?
No, I was pointing. Okay. Yeah, well, so can you cut all this out? Was it recording?
Okay, Edward, we're recording now. Is everything good and right? And
Yes, I can see that it's recording.
okay, fabulous. So Jen's gonna go ahead and take over and lead through the presentation.
You go first.
Good.
Action.
Yes. So, we'll have a moment of silence
Yeah.
and just say, hello, everyone.
Hello, everyone. This is Julie Foster Hagan, and I am the Assistant Secretary with the Office for Citizens with Developmental Disabilities. And I'm joined today by my co-presenter, Jen Katzman, who is the Medicaid Deputy Director. And we're here today as a public forum for our Act 421 Children's Medicaid Option. And this meeting is being conducted virtually in order to avoid large gatherings to help ensure the health and safety during our public health emergency. We encourage you to visit our website, which is www.ldh.la.gov/Act 421 to submit any comments. You can also email 421-CMO@la.gov to send questions or comments. I'll quickly go over that again. Our website is www.ldh.la.gov/Act 421. And our email address is 421-CMO@la.gov. And comments and questions can be submitted at both of those locations. So with that, we'll get into our informational session with you guys today. And what we want to do is talk to you again about the Act 421 Children's Medicaid Option, which is being submitted to CMS. And this is a public forum to explain the program and to solicit comment and feedback from the public. So as an overview, what is Act 421? So during the 2019 legislative session, Act 421 was passed, and it asked the Louisiana Department of Health to start a program that lets certain children with disabilities receive Medicaid coverage, even if their parents earn too much to qualify for Medicaid. Louisiana's program is modeled on the federal Tax Equity and Financial Responsibility Act, which is also known as TEFRA. We do want to be clear that we are not implementing a traditional TEFRA program, but you may hear this name in connection with the Act 421 Children's Medicaid Option. So who is it that can receive coverage under the Act 421? In order to qualify for coverage under this program, there are 5 factors that need to be met, and all must be present in order to qualify for the program. So this program is for children who are ages 18 years old or younger. They have a disability, which is defined as a medically determinable physical or mental impairment that results in marked and severe limitations and has lasted or is expected to last at least 1 year or to result in death. They must meet the level of care given as an intermediate care facility for people with intellectual disabilities, nursing home level of care, or hospital level of care to qualify. The children must be able to be cared for safely at home, and the care at home must be less costly than that if the child were in an institution. So the purpose of Act 421 and why this is needed is the goal of the program is to help children avoid long stays in hospital, nursing facilities, or intermediate care facilities, which we often call institutions. So the goal is to help them avoid those stays in institutions and to remain living home with their families. Children with disabilities may have needs that are not covered by their private insurance, but their parents' income is too high for them to qualify for Medicaid coverage. And normally, income and assets of a child's parents are looked at when deciding if the child is eligible for Medicaid. Some children with disabilities may not qualify for our home and community-based waivers because they don't have the urgency of need requirements that are that we now use to provide home and community-based waiver offers to folks. But the children may still have needs that are not able to be met under a private insurance plan of their parents. So Act 421, Children's Medicaid Option, will allow certain children with disabilities who are not receiving home and community-based waivers and whose parents are over the income limits of the Medicaid program to still be able to get Medicaid coverage. And Act 421 enables parents to continue working while closing that coverage gap between private insurance and Medicaid. Under the Act 421 Children's Medicaid Option, there is considerations that must be given to both level of care and cost of care. Under level of care and cost of care assessments are both required under the provisions in the Act itself. So LDH currently assesses whether a child would need intermediate care facility, so ICF level of care, or we already have a process in place for doing that for children with developmental disabilities who are seeking a home and community-based waiver. And this existing assessment process is known as a 90L process. And in the 90L, we will continue to use that for children with developmental disabilities to assess Act 421 Children's Medicaid Option. In the 90L process, the child and family will have written documentation that comes from their physician or nurse practitioner or physician's assistant can sign, indicating that the child meets that level of care. And then assessment for hospital and nursing home level of care will evaluate required medical interventions and functional limitations. These assessments will be done at the local governing entity in the region in which the family and child live. And the assessments will be performed by a registered nurse who uses medical records and does interviews with relevant people to help in the determination of the assessment. And then for cost of care assessments, again, these are also required by Act 421. And there has to be an evaluation to determine that services must cost less in the home than they would in an institution in order for the child to qualify. So under our Children's Medicaid Option, we next want to share with you what our timeline is in relation to the implementation of this new program. So we are currently in what we call our state public notice or comment period. That must last 30 days. So we submitted the 1115 demonstration online and submitted the information about these public comment periods on July 10th. So for our 30 days, you will be able to send us any comments or questions related to the application or the information we're sharing with you today during that 30-day window. Our goal is for September 1st to submit the 1115 demonstration application to the Federal Centers for Medicare and Medicaid Services, also known as CMS. When we submit our demonstration application, that application must include all public comments received through these public forums and through our webmail and email address I gave you at the beginning of the presentation. So the application will have those comments and any of LDH's response to those comments. And based on your comments, there may also be changes made to the application based on the feedback. So the application to CMS will outline all of that information. And then CMS has a deadline once we submit on September 1 by September 16th, CMS must notify us whether the application is complete and can proceed. So they do not have until September 16th to give approval, but to review and advise us if there's any additional information needed with our application for them to be able to consider. And then CMS posts the draft submission of the 1115 application on the CMS website for a second 30-day public notice period. During the months of September through December of 2020, we will begin preparing for program launch, which includes finalizing all of our procedures, conducting trainings, etc. We have a stakeholder engagement process already identified, and we will continue with this stakeholder engagement process as we continue to work on finalizing those procedures. And then at this time, our requested program start date is January 1st of 2021. However, we do want to be transparent that this date is at CMS discretion and is dependent on CMS review and approval. So we are not able to start this program until we do have that final approval from CMS. So again, January 1st is our target, but it will begin pending CMS review. With that, I'll turn it over to Jen.
Hello, everyone. I'm going to go over today our implementation plan, including the 1115 demonstration features and what all that will entail in our application that you may be reading online. So what is a section 1115 demonstration, and what is this term that we've been using throughout the presentation? A section 1115 is a provision in the Social Security Act that gives CMS the authority to approve experimental, pilot, or demonstration projects that will assist states in promoting the objectives of the Medicaid program and better serve the people of that state. 1115 demonstrations provide states with flexibility to design programs and implement policy approaches that are shaped to the state's needs. And so this can happen outside of the normal Medicaid state plan process. The demonstration can last for 5 years. It evaluates the program on an ongoing basis, and you can make changes through amendments like you would to any other provision under the Medicaid program. But just like this application process, any amendment to the children's Medicaid option will be subject to the same strict public notice requirements as the original application. So even if there's an amendment later down the line, the public and stakeholders will have an opportunity to provide feedback before that amendment is finalized. At the end of the 5-year period of the demonstration, LDH will assess program and make sure that we determine if a renewal is necessary at that time, or if we would like to take a different approach for coverage options, maybe expanding the scope and determining how best we want to proceed after the 5-year period ends, based on our evaluation of the demonstration. The 1115 demonstration option also gives us the ability to limit our enrollment, and it provides flexibilities in the Medicaid program whereby enrollment opportunities are limited to the number of individuals who could be served given the amount appropriated for the program by the Louisiana legislature. This allows LDH to cap costs, ensuring program stability, and it also ensures that we can preserve resources that are in place currently for existing optional programs in Medicaid. And there are many optional programs in Medicaid that people don't realize. Things like home and community-based waivers are optional programs. So we want to preserve their funding by making sure that we tie our service options under this new program to the appropriation that we get from the legislature and don't go over that amount. So to that extent, we have a current appropriation in our fiscal year 21 budget, which is the time period of July 1st, 2020 through June 30th, 2021 of $13.6 million, which is the funding required for 6 months of the program, starting January 1 of 2021 through June 30th of 2021, which is the end of that fiscal year. If we can get the appropriation from the legislature for a full year of funding, it would equate to around $27.2 million for a full year. Using this appropriation, we've determined that we can serve up to 2,540 children. One feature of the demonstration will also be a private insurance requirement. Families will be required to keep existing health insurance coverage for the enrolled child. Hardship exceptions will apply for families experiencing unemployment, loss of insurance due to changes in employment, or when cost of insurance exceeds 5% of household income. And costs of insurance include things like premiums, copays, deductibles, and the state will use that information to calculate against the household income to see if there's a hardship exception that might apply. There will be a 6-month look-back period where the state will be assessing if the private insurance was maintained for that time period before registering for the Act 421 Children's Medicaid option. We need to do this to ensure equitability of the program and that people are not dropping their private insurance and putting other people in the program at a disadvantage so that everyone is treated equally as they register. For those who do not meet a hardship exception and they subsequently voluntarily drop their private insurance after they've been enrolled in the Children's Medicaid option, there will be a 6-month lockout period from services, which means that we will not stop the slot coverage of the child. They will maintain their existing slot in the option, but they will not be able to access services for a 6-month period until their private insurance coverage is resumed. There will be an exception for that lockout period if the family applies for a hardship exception, or again, if they resume that private insurance coverage, their services will resume sooner than the 6 months. If after the 6-month lockout period, they still have not resumed private insurance coverage and they do not meet a hardship exception, then they will lose their Act 421 Children's Medicaid option slot. Families will be able to apply for the Louisiana Health Insurance Premium Payment Program, otherwise known as LHIP, which pays premiums and Medicaid costs not covered by commercial insurance for eligible Medicaid recipients. Families are eligible for LHIP when the overall cost of the enrollee's private insurance, premiums, copays and deductibles, and cost of services that are not covered by private insurance are less than Medicaid would pay if the enrollee did not have private insurance. So basically it's a cost effectiveness program for the state. If it is more cost effective for Medicaid to pay your premiums for your private insurance on your behalf than to enroll you as a full benefit Medicaid enrollee, we can enroll you in the LHIP program for premium assistance. And we encourage all families to apply. Another feature of the program will be the service delivery system through managed care. Act 421 directs LDH to implement in the most cost-effective manner possible, whether fee-for-service or managed care, and this was a legislative mandate. LDH compared projected costs using our fee-for-service and managed care program in consultation with our actuaries, and we determined that managed care was more cost-effective approach. All enrollees will be required to use one of LDH's managed care providers for services. Use of managed care will help Medicaid control the costs and serve as many children as possible within our appropriated budget. And we've provided a table of the comparison of fee-for-service Medicaid versus managed care Medicaid to help educate on some key differences in learning how the two programs operate. Fee-for-service is when the providers, such as your doctors or your therapists or hospitals, are paid directly from the state Medicaid program. It means that when you go obtain a service, the provider bills and is paid. So it's a fee for each individual service provided. This program is also sometimes called legacy Medicaid. So you may hear this term instead of fee-for-service. It is administered by the Department of Health and our state's contracted fiscal intermediary, DXC, which pays the healthcare claims. Alternatively, the managed care program is one where the state Medicaid program enters into contracts with private insurance companies and pays them a flat per member per month fee, which is like a premium, and they pay this on the member's behalf. So just like a private insurance would work where you pay a premium to private insurance for your coverage, the state pays this premium on behalf of a Medicaid member to the insurance company. Those insurance companies then pay providers on behalf of state Medicaid, which means that no matter how many services are accessed, those Medicaid insurance companies never receive more than the per member per month payment that they got. So it's not a fee-for-service program, it's a flat premium fee. There are currently 5 insurance plans to choose from, and we'll be going over more detail of the managed care program later in the presentation. Another feature of our Act 421 Children's Medicaid Option demonstration will be a subset of applicants who can expedite their offer through prioritization. LDH anticipates that more children may request services than the state can pay for based on our appropriated budget. So we developed a prioritization plan with our stakeholders that lets children with the most need receive services as quickly and as soon as possible. Eligibility for this prioritization is based on 2 pathways. If the child has been in an institution, which is either an ICF, nursing facility, or hospital, for 30 of the last 90 days at the time of their registration for Act 421 Children's Medicaid Option, then they can qualify for prioritization, and the in-facility days do not have to be consecutive. On the second pathway, it's based on the number of admissions to the facility. So if they've had 3 or more separate occasions in the last 90 days where they've been admitted to the institution or facility, then they can qualify for prioritization. Admission must be over 24 hours. Children who receive or qualify for prioritization must still prove that they are eligible for the Act 421 program, which we will also go over later in the slide deck. Registration will occur in 2 phases, and an initial registration period and an ongoing registration. And for the initial registration period, individuals who registered may apply for prioritization, and if they qualify, they will receive the next available Act 421 CMO offer. In addition, any person on the registry may apply for prioritization at any time. So this will apply to ongoing registration as well. At any point in time, someone may apply for prioritization based on their needs. LDH expects that all children who register during that initial registration period as we kick off the program and who qualify for prioritization at that time will receive offers. After the initial registration period, prioritization is valid for 6 months from the date that the prioritization is approved while waiting for their Act 421 CMO offer. After 6 months, if no offer has been made to enter the program, then the individual will lose their prioritization, but they retain their original place on the registry for Act 421 CMO, and they keep their original registration date for the purposes of receiving the next available offer. The individual may reapply for prioritization at any time. So if after the 6-month window passes, they can reapply for prioritization once again. And so that you can see how that flow works through a decision tree, we've mapped this out. So essentially, they can request prioritization under 2 different pathways. Option 1 is if they've had 3 hospital or institutional admissions in the last 90 days. Option 2 being the child has spent 30 non-consecutive days within the last 90 days in that hospital or institution. Once they submit their request for prioritization along with the appropriate medical records to validate that they qualify and we have approved their prioritization, they get to keep that for a 6-month period. Once a Act 421 slot becomes available, we determine, is the child still institutionalized? And if they are, they go straight to their Medicaid eligibility determination. However, if they're not still institutionalized, we need to see if they still fall within that 6-month timeline for the prioritization to be valid. And we say if it still is within that 6 months, they can go straight to the Medicaid eligibility determination to see if they qualify for the program. If it is outside of the 6-month window, the child will go back to the registry and not receive that prioritization offer ahead of other people. As part of the program under the legislation and as part of the Medicaid program in the federal regulations, there has to be a demonstration of disability. LDH has asked CMS to streamline this process. We currently in Medicaid are regulated by the requirement that Medicaid must determine that a disability exists if they do not meet the supplemental security, if they do not receive supplemental security income. So if they have a disability because they receive supplemental security income, that qualifies. However, if they don't have that qualification, then Medicaid has to do a separate disability determination per federal rules. So in an effort to make this as administratively less burdensome on families as possible, we are asking CMS for a waiver of that requirement by letting us determine the disability using the tools that we've built for the Act 421 Children's Medicaid Option Level of Care Assessments. Our current process is that we use the Medicaid Eligibility Determination Team, which reviews medical records, and what we'll do is we'll try to forego that process and use our assessment tools under the Act 421 option instead. We feel that they're quite robust and they will be able to make the disability determination instead of having a duplicative process. CMS requires that LDH evaluates the demonstration to determine whether the program meets our goals and furthers the objectives of Medicaid. In order to do this, we've proposed 7 theories or measures that we are going to evaluate. First measure will be that Act 421 CMO enrollees will have coverage of needed health services, including services that will help prevent institutionalization and are not available or less available under private insurance plans. We'll evaluate this by measuring the use of Medicaid covered services not commonly covered by private health insurance to the extent that's needed by our enrollees. We'll also be measuring if enrollees have a better health outcome because they are eligible for case management and enhanced care coordination as a special healthcare needs group in managed care. We'll evaluate this by measuring the usage of inpatient hospital, emergency department, nursing home, and ICF services in later years as compared to our base year usage in year 1. Our third metric will be if the Act 421 CMO will provide access to care that is more cost effective than the same care provided in an institutional setting. We'll evaluate this by comparing managed care per member per month expenditures against the average cost of care in institutional settings. We'll also evaluate if enrollment is limited to the number of children who can be served by the amount annually approved by the legislature, and if we can ensure existing optional programs under Louisiana Medicaid remain fully funded by doing so. LDH will evaluate by assessing the number of participants enrolled in the Act 421 CMO and the number of people on the registry and the funding available. The 5th metric is whether enrollees will need to maintain private existing coverage in health insurance and whether that will reduce primary Medicaid coverage costs and provide access to more participants. LDH will compare the cost of services provided with Medicaid acting as the secondary payer against the cost of those same services if there had been no other insurer and Medicaid was the primary payer. Our 6th evaluation metric will be a hardship exception for the private insurance requirement will ensure the requirement does not create a barrier to healthcare access. LDH will evaluate this by tracking the extent to which the hardship exception is applied for and approved. And lastly, enrollment in the LHIP program for eligible families will ensure cost burdens associated with maintaining private insurance are minimized as much as possible. LDH will evaluate this by tracking the hypothetical annual costs to participant families associated with maintaining private insurance if they have not been enrolled in LHIP. So next we'll go to the 1115 demonstration rationale. So as I went through the provisions around what is an 1115 demonstration, I particularly focused on the flexibility provided. And the reason is that it allows us to try solutions that enhance service delivery, and it allows us to test those theories that I just went over and see how this program can better serve the clients of the state, but also maintain our program within budget constraints. There's much unknown about this new program because these are children who have not previously been served in Medicaid, including the size of the population that may want to access these services. It's a new eligibility group, and so we have to track and measure how many may want to access the services, and the 1115 demonstration gives us the ability to still maintain our budget within appropriation based on no matter how many children may need to access the services. It estimates basically that the children trying to access the services at this time is approximately 2,800 children who currently exist on the Office for Citizens with Developmental Disabilities Registry who are not otherwise Medicaid eligible. In addition to that 2,800, we estimate around 1,000 children who are not on the OCDD registry and do not have a statement of approval from OCDD may want to access these services either through the nursing facility or hospital level of care pathway. And since we do not currently enroll these children or register these children, they're not currently tracked by Medicaid, and there's uncertainty as to estimates. So the 1115 demonstration gives us the flexibility to study the population that may require these services and still maintain our budget. So linking it to cost containment, as I was just alluding to, we get to make sure those program costs do not exceed the budget, and cost overrun will not impact other Medicaid programs and cut services to other people. Requiring the private insurance mandate ensures that Medicaid is the secondary payer while private insurance remains the primary payer, and this means that we'll only cover the costs that private insurance will not, and it saves the state money and allows us to serve more children. The hardship exception to the insurance requirement ensures no one is denied because of an inability to obtain private insurance for their child. And these are all flexibilities allowed within the 1115 demonstration that are not otherwise allowable in the Medicaid program, which is why we're choosing this mechanism. So I'm going to turn it back over to Julie to go over some of our service options.
Okay. So within the Act 421 Children's Medicaid option, enrollees would have access to Medicaid state plan services. So most, if not all, children enrolled in Act 421 will be eligible for services that are covered by the Early and Periodic Screening, Diagnostic, and Testing Program. You might have heard of this referred to as EPSDT. And EPSDT is what we know as a state plan service. They provide that under EPSDT, this provides comprehensive and preventive healthcare services for children under age 21 who are enrolled in Medicaid. So this would be the primary avenue for which those services that families may not be able to access in the private insurance would be covered. Some of these services are included in the table listed on the screen. These are not the full array of services, but the primary services that we would anticipate folks would use. It covers doctor visits, hospital services, pharmacy benefits, dental benefits, speech, occupational, and physical therapy, durable medical equipment. And then we do have some services that must first go through an additional test to determine that they are medically necessary. So case management as an EPSDT service must be deemed medically necessary. Skilled nursing and home health must also be deemed medically necessary. And applied behavioral analysis is another service that must first meet the criteria of medical necessity. We do want to be clear that while you may hear us talk about the 1115 demonstration, it is somewhat of a waiver, but it is different than what we have available now in our home and community-based intellectual and developmental disabilities waivers, which is our children's choice waiver, for children, it would be our children's choice waiver, our residential options waiver, and our new opportunities waiver. We also have a supports waiver, but that waiver is for adults. And so within those waivers, if you are a person who has an IDD waiver now, you have access to what we mentioned earlier as state plan services. And additionally, you have services that are available as a waiver service. So we do want to be clear that this program does not include those home and community-based waiver services, but only the state plan services. So some examples of what those waiver services are that would not be covered in the Act 421 Children's Medicaid option. That would be things such as home modifications, substitute family care, housing stabilization, center-based respite, art or music therapy, day habilitation, or supported employment. I do want to clarify that if a person is in the Act 421 Children's Medicaid option and they do have an urgent or an emergent need for those home and community-based waiver services, and they have an OCDD statement of approval, that would not prohibit them from going through our other process, which is our SUN screening, to determine if they need that level of care, and then they would be able to move into our home and community-based waiver option as well. So now I'll talk with you a little about our registration and our proposed registration and enrollment process for our children's Medicaid option. The first thing you'll see here is a process flow chart. One of the things we did hear from our stakeholders is that, a lot of times things get complicated, and they felt like having things demonstrated in a flow chart would make it a little bit easier for families to kind of walk through the process. And so we developed this flow chart to help with that. So as you would walk through it, if you believe that your child might qualify for this Act 421 process, we will have a registration period. So there will be a way that you would be able to register, and we'll get into a little bit more detail about those different ways in some of the next slides. But you would go through a registration process. Once you register, then you would that would happen within your region, and so your local governing entity or human services district or authority would look to see if your child had a statement of approval through the Office for Citizens with Developmental Disabilities. If they did not, then there would be an online registration form for children for the program who do not have that OCD statement of approval. Then, as Jim talked to you guys about earlier, in the registration packet itself, regardless of if the person has an OCD statement of approval or not, if you believe that they may meet the prioritization criteria related to the hospitalizations that were described earlier, then you would include documentation in your registration, so that would help us determine if the prioritization criteria was met. So then we would look to see, is there a slot available for the program? If so, or at the point that a slot becomes available, then a Act 421 Children's Medicaid offer will be sent. When that offer is sent, you will then go through the clinical eligibility or disability determination, and that is through the level of care assessment. So we mentioned earlier that if your child has an OCD statement of approval, that process is the 90L that you would go to your physician to have. If you do not have an OCD statement of approval or 90L, the other pathway we talked about is the nursing home or hospital level of care assessment, and that will be conducted at the LGE. The preference is for an in-person evaluation in addition to medical records review there, and that is done by a registered nurse at the local governing entity, and so then the determination is made. There also is the Medicaid application. So in addition to the clinical eligibility, the families will also need to undertake a traditional Medicaid application that will look at the programmatic eligibility. As we mentioned earlier, it will look at the income only of the child to make sure that it is under 300% of the federal poverty level. Ensure the child does not have or has assets under $2,000. Verification of the age, application for Social Security, ensure the child is a U.S. citizen or qualified alien, and as well as a Louisiana resident, and ensure that they are not otherwise eligible for Medicaid. Once those criteria are reviewed and established, then there will be a look to see from the same programmatic eligibility if there is current insurance, if the family has current insurance for the child. And then there will be a determination for Medicaid as the primary insurance or Medicaid as the secondary insurance. And again, we note here the requirement we discussed earlier that families must keep the other health insurance premium unless the hardship is granted. So once we have, once the offer is made and the clinical eligibility is determined and the programmatic eligibility is determined, at that point, the child would then be enrolled in Medicaid and a managed care health plan would be chosen by the family. So getting a little bit more into the details of the registration and enrollment that we just reviewed on the flow chart, there will be notification will be given to the public before the registration period begins. So for our this is specific to the initial registration. The notice is going to include a description of the program, the time period for the initial registration, and instructions on how to register online, in person, or by phone. So I mentioned earlier that we would talk a little more in detail. So we will have all of those options available to families to be able to register for the program. We're also going to make sure that when we notify the public of the opening period or the registration period for this program, we're going to try to get the word out in as many ways as possible. We'll ensure that there's a press release. We will do several social media postings on the appropriate department web pages. We have a special needs and parent support services contractor. We will get the word out through her. We will publish it on our main website, email to stakeholders who express an interest in receiving information. We will ensure all of our legislators are notified so that they can help get the word out to their constituencies. And then we do have several groups, such as the Families Helping Families in each region, the Governor's Office of Disability Affairs, our Developmental Disabilities Council, our Children's Cabinet. We have several different organizations who have news feeds or email distribution feeds, and we will get the word to all of them as well. Again, to make sure we touch everyone who might be interested in enrolling or believe their child may be eligible. So during the initial registration period, again, once we have CMS approval, we will then begin to roll the program out. And as we do, there will be an initial registration period that will last 1 month. The online applications will be used to collect information needed for the prioritization process described earlier. So again, I mentioned earlier that if you believe your child would qualify for a prioritized slot, there will be medical documentation that will need to be submitted to support that. So you would use this registration period to provide the information regarding prioritization as well. For those children who have already been determined to have a developmental disability, so that means that they have an OCDD statement of approval, but who are not currently eligible for Medicaid services, they will be automatically registered for the Act 421 CMO participation. So those of you who have children who have been deemed eligible, have had a SUN assessment, and that SUN score is 0, 1, or 2. So you did not get a waiver offer, but your child is still on our request for services registry, and the family is not eligible for Medicaid. These are the children that we're talking about here. And earlier, Jen shared with you that we estimate that to be about 2,800 children. Those kids are going to automatically be registered for the program. So all families of these children will get a pre-filled form in the mail, and it will explain what the 421 CMO program is and that they have been registered. And if the family chooses not to participate or does not want to be considered for participation in the program, the form will provide them an opportunity to indicate that they would like to opt out of the program. And these folks will also be given an opportunity in that letter to be able to submit medical information that shows that they would need to be considered for a prioritized opportunity. And so then at the end of the initial registration period, we will randomize the registrants to create a numbered order registry. So children registered in the initial period will receive the Act 421 Children's Medicaid offers according to, first, the prioritization process. So all of those children who were deemed to meet the prioritization criteria that was described earlier will be the first to receive offers. And then after the prioritization process, then it will be according to the number order on the registry. So in this initial period, it will be that randomized assessment. So first, the priority with the randomization, and then once we have opportunities for everyone who's been deemed to have a priority access, we'll then move to those who are not deemed to have a priority access in the order of that randomized number. Children who do not receive the offer will stay on the registry in the number order assigned with the same registry date. So during our 30-day period, all children that are entering the demonstration during this initial registration period will receive the same registry date. That randomized number will apply to those initial round of offers. And then ongoingly, after the initial registration period and offers, so at the conclusion of those who registered during our 30-day process, anyone who registers outside of that will be assigned a registry date and number after that 30-day period. So those will then be given, offers will then move to be given on a first come, first served basis. And the offers will be made as they become available. Families may apply for prioritization, and if qualified, the child will receive the next available waiver offer. And if more than one child is prioritized at any given time, they will be made in order of the date that the prioritization was determined. So in discussion a little more on the Medicaid eligibility determination that was discussed in the flow chart, the department will make an Act 421 Children's Medicaid offer to people who register as spaces in the program become available. Once the offer is made, the family must establish both clinical and programmatic eligibility for the Act 421 Children's Medicaid option enrollment. So remember, there are those two different pathways for the level of care and the clinical determination and the programmatic determination. We also want to be clear that when a family submits information for prioritization, that prioritization does not automatically grant eligibility into the Act 421 program. It merely advances the child to have the first available offer. So if a child does qualify for prioritization, they still must go through both the clinical and programmatic eligibility determinations for the program after the offer is made. A little bit more of a breakdown on the clinical and programmatic eligibility. So as we mentioned earlier, the clinical eligibility is that the determination that the child has a disability and that they meet the level of care criteria. So again, that is for intermediate care facility, nursing home, or hospital level of care. And as we mentioned earlier, the department has asked CMS to allow the level of care assessment to meet the federal requirements for disability as well. That will be for those children, that will be for children in the Medicaid, in the CMO program. In terms of the programmatic eligibility, that we must also assess that child meets the basic Medicaid requirements that I mentioned earlier. And again, that the child meets income and assets requirements. So for this program, the parent's income and assets are not considered, but we do have to consider, we are not able to waive consideration of any assets that the child themselves may have. All right, so to give you guys some additional information about the timeline, we will, 2 weeks prior to us opening the initial registration period, we will announce the dates for the registration period. Again, using all of the means of notification that I mentioned to you earlier. The initial registration period will last for a period of 30 days. Children, as we mentioned earlier, who have an OCDB statement of approval will be automatically registered with the ability to opt out if they choose. And then the full Medicaid application and eligibility screening will occur later. During this initial registration period, all registrants will have the same registration date. It does not matter whether an applicant registers on day 1 or day 30. So as we said earlier, during that 30-day registration, everyone will be considered the same, and then we will move to randomize them. So we anticipate that randomization will take approximately 1 week so that we can sort all of those who registered in that 30-day period. And we also anticipated taking approximately 30 days for us to go through the packets. Again, during that registration, families will have the ability to give information about meeting the prioritization criteria. And so we will have those 30 days to look at the documentation and evidence. And if the person qualifies for prioritization, they will receive the first available offer in order of the prioritization date. If they do not qualify for prioritization date, they will still keep their originally assigned registry position and date. And then from there, we will do our eligibility screening and enrollment. And so the amount of time for that to occur once we determine who will receive the initial offers will really depend on the applicant availability to participate in the level of care assessments with the local governing entity and the amount of time it will take for the families to provide the required financial documentation. So with that, I will turn it back over to Jen to talk with you guys about some managed care benefits.
Hello again. So I'm going to go over with you how our managed care program operates in Louisiana. It is called Healthy Louisiana, and it consists of 5 managed care organizations, or MCOs, who offer benefits to our Medicaid recipients, either full coverage or partial coverage benefits. And as you can see on the screen, a pie graph shows you the percentage of current Medicaid enrollees who are in managed care versus our fee-for-service legacy Medicaid program. As you can see, there's over 90% of our population in managed care receiving either full benefits or partial benefits. Healthy Louisiana is the way most of our enrollees access healthcare services. The overriding goal is to encourage enrollees to take an active role in owning their own health and the health of their families. In Healthy Louisiana, Medicaid enrollees select their own managed care organization or insurance plan, and the MCOs differ from one another in several ways, including their provider networks, referral policies, care management programs, and extra, or what we call value-added services and incentives offered. Each plan is accountable to the Department of Health. The plans must follow detailed grievance and appeals requirements, and enrollees and providers have the right to appeal first to their MCO, then to the state. LDH monitors all complaints, grievances, and appeals to assure the system is accountable to enrollees and the state. Managed care also has special provisions for persons who meet our special health care needs population requirements. So what is that population? It includes individuals who, because of their disability, require individualized healthcare approaches. LDH will designate the Act 421 Children's Medicaid option enrollees as a special healthcare needs population. They get certain benefits under that designation, including care coordination, continuity of care, care transition, including but not limited to, initial screening of needs, individualized treatment and care plans for eligible participants, ongoing preventive and primary care that's appropriate to their needs, coordination of care between primary care providers and specialists for out-of-network services, and with hospital and institutional discharge planning, and care transition in the event of a provider termination from the network or switch between their managed care plan from one to another. Our 5 Healthy Louisiana managed care plans include Aetna Better Health, AmeriHealth Caritas of Louisiana, Healthy Blue, Louisiana Healthcare Connections, and United Healthcare of Louisiana. Our children's Medicaid option has a robust public comment and stakeholder engagement process. We've involved in a large stakeholder group that we asked to participate with us in smaller work groups around development of the final application to CMS. We had numerous meetings with our stakeholders to discuss and receive input on program features. All of the presentations during those small work group meetings are archived on our website that Julie read earlier, www.ldh.la.gov/Act 421. We will continue meeting with our stakeholders in order to finalize processes and procedures before the program starts. And we will also meet with our stakeholders after the program launch to monitor how the program is doing and ensure the features are working as intended and enrollees have their needs met. If you want to get involved, please join us. All are welcome. We're really looking for families who are interested in these services, who plan to access these services, to give us their feedback and participate in the design of the day-to-day operational functions. If you're interested, please email us at 421-CMO@la.gov, and we will start including you in our stakeholder meeting invites. Public comment, as Julie said, will last for 30 days through August 10th. You can view the full 1115 demonstration application on our website, and you can send us comments to our email 421-CMO@la.gov. You can also submit the comments directly through our website where there's a button you can click and fill out a form for public comment. Or you can mail those comments to Bureau of Health Services Financing, attention Act 421, Children's Medicaid Option Manager, at P.O. Box 91030, bin number 24, Baton Rouge, Louisiana 70821-3117. Comments will be incorporated into our final response in the waiver application. And so that brings us to the end of our presentation. And we did receive some questions that we would like to go over and answer for you today. And so I'm going to read them aloud, and we'll make sure that these get incorporated into our final application. So our first question was, is there going to be a provision for the eligibility determinations to be made in the virtual environment? In this COVID environment, we are told by some local governing entities that interviews must be held in person or face-to-face, but that these interviews have been suspended due to COVID precautions. And so in general, just know that we are working with our local governing entities on protections relative to COVID. We are aware of this need. And while our assessment is a face-to-face assessment, there are exceptions for the needs of the child, and there will be certain exceptions made in order to protect the child that may be at risk due to COVID and our public health emergency situation. As you know, we are going to be waiting on CMS approval for this program. And so depending on when we get that approval and when we're able to go live, there may be a different state of affairs in the state at that time. So we'll have to reassess and see where we are at the time of actual program launch. But if we are in still a state of public health emergency, if we're still seeing a rising number of cases and we believe that there's a health risk identified, we'll be working with those local governing entities to provide available precautions for families who are at risk. Our next question was, will there be new slots available each year, or will all available slots be allocated immediately? And will some be held for an emergency need? So the short answer to this is, because we've received the appropriation from the legislature at this time, we have to fund all slots available with that appropriation immediately. So no, at this time, unless we receive additional legislative appropriation, there would not be new slots added each year. And there would not be any held in reserve for an emergency need. However, that was why we created the prioritization method for families who do have more urgent needs due to repeated institutional care or long stays. They can basically get an expedited offer for the next available slot based on need. Our next question was, just for clarification, this is for the Medicaid waiver. And I think what we're trying to ask here is this a Medicaid waiver? And that's that was kind of addressed earlier in the presentation. Essentially, yes, an 1115 demonstration is a type of waiver, but it is not your standard common waiver that we're most familiar with under the home and community-based services waiver programs that Julie mentioned earlier that offer those additional services. So it is not a traditional Medicaid waiver. We also received a question about, will the MCOs be held to the same quality measures for this population, or will separate quality measures be established? And so we'll take that question back and we'll continue to work on that. We are working on our contract amendment with the managed care organizations at this time, and it's not finalized. We actually plan to bring that contract amendment and the provisions therein to our stakeholder group. So if you're interested in participating in that and helping to define what quality measures we want, what type of reporting we want, care coordination and other considerations for this population for our special healthcare needs group, then please do try to participate and get enrolled in our stakeholder meetings, because that's where we'll be defining those processes and those requirements. We got another question on, how do we determine whether we have an OCDD statement of approval on file already? And I'll leave that to Julie to answer.
Sure. So for families who are not sure, those who have an OCDD statement of approval all have had to have gone through what we call an eligibility determination process with their local governing entity or human services district and authority. And so once they go through that process, that there is documentation. There are periods of time when you would have to go through a redetermination depending on your child's age. So if you're not sure where you are in the process, or if you would like to apply to be considered for eligibility for our OCDD services, you can call your local governing entity or your human services district and authority. If you're not sure who that is, because we have 10 of them in the state, depending on which parish, you can go to our Office for Citizens with Developmental Disabilities under the Louisiana Department of Health website, and we have a listing there of a map with the parishes and the regions, and there is contact information for how to get in touch with their developmental disabilities office, and they will be able to give you further information about how to apply, and or if you already have an OCDD statement of approval.
So we have one last question that we received, and this is if children in the Children's Choice Waiver who get case management, can they apply or be eligible for the Act 421 Children's Medicaid option if they only need the standard full coverage Medicaid benefit under our state plan and don't need the additional waiver services and just need the case management? And so the answer to that is that if you're otherwise eligible for Medicaid, then no, you are not eligible for the Act 421 Children's Medicaid option. So children who are already in the Children's Choice Waiver and receiving Medicaid services cannot then switch to the Act 421 Children's Medicaid option, because there are limited slots based on our appropriation, and we're trying to preserve those slots only for children who do not otherwise access Medicaid through other resources or services or means. And so we're trying to keep it only to those children who cannot get Medicaid any other way. So if you're in the Children's Choice Waiver, then you will stay in the Children's Choice Waiver. So I think that is the last question we've received, and we will be posting all of our presentations online. Any last announcements, Julie?
The next presentation that we will have, we have a public forum scheduled for Monday, July 29th, 2020, beginning at 4 o'clock. And we will be presenting this same information, clarification. The next public forum will be Monday, July 29th, 2020, beginning at 4:30. And you will be able to hear this presentation at that time as well. And we'll have an opportunity to enter questions into chat or ask questions verbally if you are unable to access via chat. And that will be our final public forum in relation to our Act 421 program before submitting the application to CMS.
And it will be the same presentation. So if you've heard this one today, it will be the exact same presentation on Monday starting at 4:30. So we thank you all for your attention and we appreciate your time. And if you have any comments, please do feel free to submit those to us through the avenues on the screen, and we will consider all of them. And thank you again. Have a nice day.